Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program here on 96.5 FM, Power 96.5 FM, and 1080 AM WUFO. I'm your host, Francesca Messiah, Manager, Workforce Development from Kaleida Health. Kaleida Health, I still get that question. People still aren't sure what Kaleida is, and that's why I review it every week. We are Buffalo General Hospital, Oishei Children's Hospital, Millard Fillmore Suburban, Gates Vascular Institute. We also have the 24-hour care in your home with the Visiting Nursing Association. And we have two long-term care facilities. That's High Point, corner of High in Michigan in Buffalo, and DeGraff Memorial and DeGraff long-term care facility in Niagara County. Also at DeGraff, we have an ER, 24-hour urgent care. I should say ER, it's an urgent care facility, also on the property of DeGraff in Niagara County. We have oncologists, we have social workers, surgeons, and also if you are, I just have to add this, if you're thinking about changing careers or if you're looking for a job, please visit www.kaleidahealth.org. And then underneath, you'll see careers. Click on careers where we have over 800 positions available, ranging from careers and jobs that require a high school diploma or a GED, all the way on through a PhD. So check out that website. Well, we have our guest for today, our first guest this half hour, no stranger to the program, and that's Kelly Cardamone. Good morning, Kelly. How are you?
Good morning, Francesca. I'm doing well, thank you. And thanks as always for having me.
Oh, you're welcome. Kelly is a registered clinic. She's a clinical nutritionist and diabetes program manager with general physician's practice. She has an office right here in Buffalo on the bus line. Great. She's a wealth of knowledge and working on her PhD in nutrition. So she is an expert. And then in our second half hour, don't hang up. Please don't hang up after after the first half hour, because our second half hour today, we have Dr. Fred Archer III. He's a pediatrician, and our topic in the second half hour that starts at 7:30 is maternal and infant mortality. Well, on with our program today, where we're talking about maintaining your healthy GI digestive system. So, Kelly, briefly, what is the body's GI and what happens if your GI is not well maintained?
So the gastrointestinal system, and many people think of it as it's just your stomach, right? But it really is
Right.
complex. Yeah, it's a network of organs that helps you digest, so basically break down and absorb your food. And it's really connected from your mouth all the way to the other end at the anus. So it's basically in one end and out the other. But if you think about it, there's a lot that goes in there. Then it packages up the waste from when you eat your food and then it excretes it out. You get your bowel movements. It really contains two systems. So you've got your gastrointestinal system and then the biliary system. That's your gastrointestinal tract. So to give you some idea of what, again, people think it's just your gut, but what organs are in there? You've got your mouth, esophagus, your stomach, your small intestine, large intestine, and then you get into the liver, the gallbladder, the pancreas, and the bile ducts. So there are a lot of organs that really help the body do this job. And right, it's necessary to break down the food because we need that energy and nutrients in order for the body to function optimally. So what happens if it's not well maintained? You asked, right? So sometimes the symptoms are really subtle, and but it can impact daily life. So you got to think about those are a lot of organs in there. I mean, you can have really more chronic diseases and milder diseases. Some are going to be just symptoms. So some people get IBS. Some
Which is
people might,
irritable.
yeah,
That's
sorry, irritable bowel syndrome. You might actually have IBD, which is inflammatory bowel disease, which could be ulcerative colitis, Crohn's. Liver disease is a real common one. We got 25% of the population worldwide and in the US with non-alcoholic fatty liver disease. People get diverticulitis. You might have reflux, which you see it as GERD. So it's reflux, right, where you get that heartburn. There's a lot of things that can happen when that GI tract is not in good health, I'll call it. And the last thing I just want to throw in there is everybody, doesn't remember or doesn't even think about. So that microbiome, right? That's part of your gastrointestinal system. But your immune system is in your GI tract. 70 to 80% of your immune cells are in your gut, right? So if you keep the GI tract healthy, hopefully you have a good immune system and vice versa.
My cousin saying that his mother, my aunt, had told him once that if you're sick, have a good bowel movement and you'll be fine. So is there something to be said about that?
So good. So I have to tell you, as a registered dietitian, I talk about bowel movements. We call them BMs. I talk about them all the time. Because when you eat, you have to get rid of the waste. And so there is something to be said. Now, just because someone has really good bowel movements doesn't mean they might not have reflux or hernia or ulcer. You absolutely can have those other things. But yeah, a good bowel movement means things are moving like they should. You should have a good, solid bowel movement daily. There shouldn't be any pain associated, bloating, all that stuff. So, yes, I think there is something to be said for good bowel movements and good health.
And I don't want to get too off the subject. So you're saying if, say, it's the weekend and you're just eating a lot of junk, you're eating wings and pizza and a piece of cake, and you do that for 2 or 3 days, that affects your immune system? Is that what you're saying?
Well, how about this? It impacts your microbiome. We know that now. So to put it very simply, that microbiome or microbiota, it's your ecosystem. So it's basically the bacteria in the gut, right? And
Right.
so could it impact your immune system? Yes. Do I think that all of a sudden you'd get sick from that? I mean, no. But over time, yes, it can impact that immune system if there's that disruption as well in the immune cells, but also the microbiome. So that's something short term. Might you feel it? Yeah. I have people that'll say, I've got bloating. Now I've got stomach pain. Sometimes they get constipated when they eat like that, or they might have diarrhea.
Huh. Okay. All right. Well, okay. All righty. I'll leave it up that. And that might be because that could be a whole nother show. I didn't realize
Yeah.
the GI affected so many parts. Is GI is it the same as upper GI as a lower GI? And again, GI means the entire your entire from your stomach to the bottommost part of your body, right?
Yeah. So
Okay.
yeah, the gastrointestinal system, again, so you've got gastrointestinal, like I said, in the biliary system. But the thing is that your upper GI so think of upper like stomach and up, but it's your mouth, esophagus, and the first part of your small intestine, which is called the duodenum. And then there's other parts of the small intestine. And then the lower GI is usually the rest of the small intestine, but to be specific, it's called the jejunum and the ileum. And then you get into your colon or your large intestine.
Okay. Like a colonoscopy would then affect your lower GI.
You got it. Yep. And if you did an upper GI, that would be called when they go through the mouth and the esophagus, that's an endoscopy. So that's an upper GI.
Okay. And I know we've kind of said this, but so how does the GI system become off balance? So let's say what are some of the more common things that you've seen in your profession?
Yeah.
What could cause a GI, and does it become off balance overnight?
It can. So if you've ever had food poisoning, right, which impacts millions
Yes.
of Americans every year, especially this time of year I'm always the one at the parties that is like, I'm the food police, as I'll call it, because I'm like, we got to put that away and you can't eat
Sure.
that and you have to reheat it properly. So something like that absolutely could cause a disruption, right? Because then you get like a bug. Sometimes when you travel, I had that happen when I traveled overseas and drank water that I accidentally was not supposed to. Oh, it instantly threw off my GI tract for weeks. So, yes, it can happen that suddenly, but other things that can happen over time. Medications can impact the GI tract, illnesses, even just again, the food that we're eating. So, that poor nutrition can impact that GI tract. And that usually takes place over time. Stress is a huge thing that impacts your immune system, excuse me, not your immune system, your gastrointestinal system. That's one of those main culprits for IBS, or that irritable bowel syndrome. Anatomical issues. So sometimes we have anatomical, we've got twisted colon, things like that. So there's many things that can impact how that GI tract functions.
Yeah, I've heard people say that they have some of these things. Very interesting. Are there foods that have a greater tendency to make the system feel off balance? I mean, we are getting into football season, and many times when people say let's get together for football, it's normally your pizza, your wings, your taco nacho dip with the cream cheese and everything else in between, and and your chicken wing dip.
You named all of the things that would cause really disruption. So what it does is so they can be harder to digest. If someone has reflux, and especially like spicy food and fatty foods can cause that heartburn, that indigestion. As I spoke earlier, like they also impact that microbiome. So processed foods, sugary foods, fatty foods, all of those things can impact, yeah, how the GI tract functions and how you feel. The standard American diet, right, is sad. Standard American diet is really the diet that is disrupting the GI tract and causing a lot of our chronic illnesses.
Hmm. Something you just said, which is something that I know I have a very bad habit of not doing, is you talked about reheating food properly. I like cold food. So what foods, and I'm sure there are other listeners who like cold pizza or cold fried chicken. What are some foods that we need to reheat properly if we're not doing that?
So, I mean, things that are left, so things that are like left in the refrigerator, like there are certain things that it's okay, they don't need to be reheated. Like, if you have things in there like, your cheese and yogurt and things like that, right? Like those are all okay. Nothing should be left out at room temperature for more than 2 hours. These are just tips. And if you cook something and you let it get to room temperature, really within that 2 hour time frame, it's got to be put, in the refrigerator. I think back when I was a kid and we used to have pizza and it would be left out overnight and we would eat it the next day. I think a lot of us did that depending on how old you are. And that's
Right.
it's a terrible thing to do. Things like fruits and vegetables are okay. It's really when you run into things that contain animal products like your creams and meats and dairy, those are really the concern. Like your salad, of course not, right? But if you had a casserole that you made, or you made taco meat, or you had chicken, or you had fish the night before, you really should. I mean, can you eat it cold? Yes, all of us do. But there are certain individuals that really should reheat those items to make sure that they kill all the microorganisms. You got to remember the refrigerator slows it down. That doesn't stop the microorganisms from growing. Like when you are pregnant, if you have if you have an immune compromised system, if your system's immune compromised, those leftovers should be reheated to 165 degrees. But that requires taking out a thermometer and, you know what I mean, putting it in there and making sure that it's 165 degrees. And I'll just throw something else out for pregnant women. They tell them no lunch meats because of very high risk for listeria and other foodborne illnesses. They tell them they're supposed to heat lunch meats up to 165 before they eat them.
Wow.
Yeah.
And I was going to ask you a couple questions around that, but I've never, this is the first time I've ever heard about heating lunch meats. Never heard about that.
Only if you're pregnant. So, or you're immune compromised. But if not, you don't have to do that. Um, but in general, look at something, look at expiration dates, smell, go by smell and taste. The hard part with that is that as we get older, a lot of our senses are compromised. So my older patients, maybe their sense of smell isn't as good. So you can't always use that as the way to tell, or that meter, I'll call it.
Mm-hmm. Well, yeah, and people like me, I haven't been able to smell food for the most part in years. I walk into a restaurant, let's say an Italian restaurant, I'll smell spicy, I'll smell garlic, something garlicky for about 30 seconds, and then after that, I don't smell it at all. You
Yeah.
know, so I never even thought about being a little more, just being aware of what foods, just go by the expiration date. That's my best bet is the expiration date. Um, oh, okay, all right. How would someone know if if their system was off balance? Is that only, and I ask that question because there are so many commercials, and I guess for lack of a better word, commercials like, well, if you can't, swallow or can't do this, take this pill, take that pill. So it seems like there's a lot of self-diagnoses, remedies on our television, but
Yeah.
how can you really tell what's going on?
I mean, first and foremost, if you're having significant symptoms and they are really impacting daily living, or you find that something's worsening, absolutely speak with your provider first off. And then definitely go see a gastrointestinal doctor. So, as you mentioned, I'm doing my doctorate, and I really had the pleasure of, I had to do a residency as part of my doctoral program. So, I really got to spend time with our GI team at General Physician, especially Dr. Corsanti. So, and it was really eye opening, and it was really helpful to watch procedures and colonoscopies and things like that. And why I bring that up is I was also able to go in when he was seeing patients, and it's really interesting to see that the GI doctors, even, they ask a lot of questions that we ask as well as dietitians, like looking at lifestyle, and because it really is all encompassing. And sometimes, as I said, you might have symptoms. I could have three people. You could all have the same symptoms, but you're all going to perceive them differently, right? The severity of the symptoms. But a lot of times, how do you know? When people come in and they're like, I have, difficulty swallowing, or food gets caught, or I have constant burning in my stomach or in my chest. Maybe they have severe bloating and gas, like all of the time. Most commonly, we see patients, they are severely constipated. I have some patients that have a bowel movement once a week, which is not great, once every 2 weeks, or they're having multiple bowel movements all the time, meaning they are going 4, 5, some people 8 to 10 times a day, where they're like, I can't leave the house. I can't go anywhere because I'm afraid I'll have to go to the bathroom. And those are just the ones you notice. Like with liver, for some patients, they don't notice it till it's really significantly progressed, with the liver disease and function. So some of them, I think, when they're in their early stages, you'll notice it sooner than other individuals when they become more progressive, if that makes sense. So it depends on what area of the body it's impacting.
Well, you know what? And you mentioned liver. You said 25% of the country has a fatty liver disease. Can you feel it? Is that something? What would be a symptom of your liver possibly, needing to see your primary care about if what does it feel like? Are there any symptoms?
So for some people, they do, but I will tell you, and I talk about that in a second, but I will tell you that most of them don't notice it in those early stages, right? Because we even have kids that have this fatty liver disease. But a lot of times it might be fatigue or not feeling well. And you might get pain or discomfort in the upper kind of right belly region. Then, when it gets really progressive, people will find that they might be getting fluid buildup. You'll feel it around the belly or the stomach. They might get swelling in the legs, jaundice or yellowing. That's more severe. But I will tell you that most doctors are checking, especially when someone is with obesity now, which is really common, right? 42% of the national population here in the US, that they're checking liver enzymes. So a lot of times that's the first step, is looking at those liver enzymes. And I just want to throw something in here because a lot of people don't understand this. So every part of your body, right, is fed by your GI tract, meaning like you need the nutrition and the nutrients. But the interesting part is that the portal vein, and it's the one time in the body where the blood is carried to something. Veins carry blood away from the organs, but it's the one time that it carries it to an organ. But the gastrointestinal tract, so all the blood from that biliary system and the GI system really gets dumped into the liver, right? Because the liver filters everything. And the interesting part is that the diet that you have directly impacts the liver, right? It's the first organ being fed. And we find that a lot of this fatty liver, they're calling now a metabolic dysfunction, right? People always think of fatty liver as from alcohol, and it can be, but this non-alcoholic fatty liver, it really is from diet. It's diet and lifestyle. It's obesity, and it's the standard American diet.
Okay, so is there anything we can do to clean the liver? If someone can, would they make an appointment to see you, or is there anything,
Yeah.
listeners can stop doing and start doing? Can a stop and a start?
Absolutely. So there's a lot of things that can help the liver and, keeping blood pressure in check, believe it or not. So watching sodium intake, eating that healthy diet of fruits and vegetables. I know I say this, Fran, on every single show, your fruits and vegetables.
Right. Yeah.
High fiber keeps the GI tract healthy, the bowel movements, it keeps the liver healthy. Eating foods that have pre and probiotics in them. So fiber is part of that, but is also like cultured foods like yogurt and kimchi and even doing like apple cider vinegar. Those kinds of things can help the diet help the GI tract and the liver, lower fat. So when someone comes in to us, we look at all that and try to put them on the right track. There's no way to cleanse the liver. You'll see a lot of that anecdotal stuff, like do a cleanse. Your kidneys and your liver filter and do what they need to do for the body. Because if they're not, you're not going to be in a good place health-wise, right? So a lot of the stuff out there is anecdotal. How do you clean the liver? Just eat healthy. So if they want to come and see myself or my team, and a lot of times we are covered by insurance plans, many times, the number to call for us is 716-748-4000. And we do require a referral from your doctor, but most any doctor will give you a referral. They usually are excited that you want to come to see us, to see the dietitians.
Yeah. And say your phone number one more time, please.
Yes, it is 716-748-4000. So 716-748-4000.
4,000. Thank you. What should a healthy GI feel like? So what should a healthy gastrological tract feel like? I mean, you talk about your belly, your throat, no constipation. What should you feel like?
You really should feel, again, as if it's really complex, but overall, if your GI tract's, in a good place, I'll call it. Again, there's a lot more to it, but it's one of those when you eat your foods, meaning you don't feel overly bloated, abdominal pain, gas. You feel that you're having good daily bowel movements. You have good energy, good sleep. And think about it too. If your GI tract's doing its job, your hair, skin, nails, all of those things will, essentially be in good condition. Now, granted, it's based on what you're eating, but you will feel healthy. I know that's, what I mean, you will feel strong and healthy. And it's just feeling good. I call it vitality, right? So you have that vitality.
Okay. Another question, because I've met little kids who have said they can't eat different things because they have acid reflux. How early I should say, can someone be born with a compromised GI system?
Oh, absolutely. So you can be born with motility issues. There are also what we call congenital gastrointestinal anomalies. So sometimes you have an underdeveloped organ. Sometimes you have twisted organs. Maybe there's a blockage in there. We're looking now at these autoimmune diseases like ulcerative colitis and Crohn's. There is thought that there's a genetic link to it. Now, by the way, that doesn't mean you necessarily are going to develop it, right? Because you have a gene means you have a higher, let's say, predisposition to it. But those are things that you can be born with, or the susceptibility to something that will put you at higher risk. Celiac disease is another one. So these are things that can impact again, from an early age for some individuals, because there are younger children and toddlers that have been diagnosed with Crohn's and celiac disease.
Mhm. We only have a few minutes left, but so what are some of the key tips, the key takeaways that our listeners should, at least listen to and try and stick to, to adopt for a healthy stomach, a healthy gut, healthy digestive system? What are a few tips that they can start tomorrow?
Believe it or not, exercise, I mean, it helps, of course, with weight as well, but exercise a lot of times can help get the GI tract moving. So good bowel movements, a good diet, avoiding that standard American diet, eating your fruits and vegetables, and I cannot stress fiber enough. There are many times even taking Metamucil, talk to your doctor about that, but can be beneficial. That psyllium husk fiber can help with cholesterol levels, but can also help bulk your stools. So eating that healthy diet, avoiding the sugar, avoiding what you talked about. I know football season's coming up, but bring or make sure there's a healthy choice available. If you're making a dip, use the lower fat cheese in there, the lower fat or fat-free sour cream. There are ways to make those recipes healthy and they still taste great. Making sure that you are, again, watch your bowel movements, make sure that you're having a good bowel movement every day. And like I said, if you're not, speak with your doctor, monitoring those symptoms. If you notice you're having some significant symptoms, don't ignore it. Make sure you call the doctor and make sure that someone's assessing it. And then bottom line too, I said to increase fiber, you got to make sure that you increase your fluid intake. So staying hydrated and making sure your beverage is water and not something that's pop or juice. I'm okay with sugar-free beverages, but there are some studies now showing that those artificial sweeteners may be disruptive to the microbiome. So if you're going to have a diet iced tea or pop or something, make sure it's, maybe a 12-ounce can or less per day. So keep that
Right.
limited as well.
And Kelly, on that note, I'm going to say thank you. And if anyone has any questions about diet pop and stuff, I'm sure there are probably 300 pages on the internet talking about that. So if you don't believe Kelly, go to the internet about diet pop. So, but Kelly, this is not our last time on the Great Lakes Health Radio program, but I want to thank you again so much for being our guest and guests. I have to let you know, Kelly does do public speaking. I've had her at several events in the community. She's very relatable when it comes to maintaining a healthy GI, gastrological digestive system. So again, Kelly, thank you so much for being our guest today on the Great Lakes Health Radio program.
Thank you. I always appreciate it. Thanks again.
Thank you. And guests, don't change that dial. Part 2 of our program is coming up with Dr. Fred Archer III talking about maternal and infant mortality. So please, I will be back with you within 4 seconds. Bye-bye. And now on to part 2. Welcome back to the Great Lakes Health Radio program on Power 96.5 FM and WFO AM. If you're joining us, if you missed the first half hour, you missed an extremely exciting show talking about your stomach health. And today, in the second part of the show, we are with Dr. Fred Archer III. Good morning, Dr. Archer. How are you?
I am fantastic. How are you?
Oh, wonderful. And Dr. Archer is an attending physician. He's a pediatrician, an attending physician at Niagara and Buffalo Pediatrics. And he's been practicing pediatric medicine since 2004. Well,
it feels like longer.
It feels like longer. Well, today, it was just yesterday. But today, this morning, the second part of our show, we'll be talking about maternal and infant mortality. And it's a topic that really isn't new. I will not say it's not new at all. However, I am so glad that it's now in the news, very focused topic, especially with African American women and women of color. So we're just going to start. Dr. Archer, maternal and infant mortality. Briefly, what's the history and why suddenly is it making such great headlines? Why now are we even having this conversation?
Well, it's an important topic. I'm glad you're devoting some time to it. It's not necessarily something that's new to humans in history. It's been unfortunately something that we've had to deal with since the dawn of time. But now we have data, and now we can track these things. And as scientists and clinicians, we want to make sure if there's something we can measure, we want to make sure we have better outcomes on it. And unfortunately, the things that we pay attention to is in this day and age with the science and technology we have, it should not be as frequent as we feel that it's occurring. One thing that I think is the reason why it does become such a big deal is if you look kind of at world statistics, the United States kind of hits somewhere around 50th out of 200 some odd countries. And we feel, well, we have a lot better tech than that. Why are we still running with these levels of maternal and infant mortality? So that's something that surprises a lot of physicians. So one reason why is that it just should not be happening, at least as we feel, at the rates that it does. One of the concerns that we sometimes see is, at least in the United States, around 5.4, if I remember the data correctly, out of 1,000 live births, unfortunately, run into some problems, at least overall in the United States, which should not be occurring. And those rates can actually vary depending upon your socioeconomic background, which is just odd. We feel that everyone should have access to good health, and that's one of the biggest barriers to it. When you break it down, kind of like, and I don't like to use racist statistics and things, but that's how we categorize things. When you're looking at per 10,000, per 100,000 live births, the maternal mortality rate overall hits somewhere around, I'd say, in like about 28, 29%. But when you break it down by different groups, you notice that there are some disparities in there. At least as of the last data around 2022, you've got about 50 per 100,000 live births where the mother can have a problem if her background is African American, which is different than about 20 if her background happens to be white, or about even 17 if it happens to be Hispanic. These numbers really just don't make a lot of sense to us from a scientific standpoint. So whenever we see numbers that don't make sense, we're like, okay, well, what's going on? That's just is not right. And because we see such stark differences in these numbers, we want to pay attention to that and see what can we do to address them. The good news is between 2021 and 2022, those rates actually improved, but they still shouldn't be as high as we see them. And there shouldn't be disparities between different groups.
And I just want to mention that back in July, a few months ago, there was a maternal and infant mortality conference sponsored by, I believe it was the Health Equity group with Pastor George. And unfortunately, I was unable to attend, but I know a lot of focus has been given to this. So thank you, Data. Thanks to Data. How would an expectant mother or even someone in her circle, meaning that the family, is there a way of recognizing if she is at risk? Is there something because sometimes, moms are just overwhelmed with expecting a child, but sometimes her circle around her may see something that may indicate that there could be a problem. Are there anything that the loved ones around the expectant mom should be made aware of?
Well, it's definitely not like, oh my gosh, if you see sign X or A or B or C, that's definitely an indication. It's a constellation of factors. The most important one is that expectant mom following up with an obstetrician? Does she have a routine OB-GYN that she is following up with? Once she does find out she's pregnant, a lot of people, as we know, don't know they're pregnant immediately right away. Sometimes it's several weeks or maybe even months. So getting connected with your OB-GYN as soon as you find out you're pregnant and are looking to make sure you want that baby to come along is one of the most important things you can do, because then they can track along and make sure that your blood pressure isn't having a problem, that you're not having an issue with blood clots, that you're having healthy nutrition, that you're having appropriate mental health, as we know that there's a lot of stresses we're all dealing with, and that mental stress can put a lot of physical stress on the body as well. So the number one thing I would say to anybody, and this again, this is my capacity as a pediatrician, not even an obstetrician, but if that baby's going to do well, that mom has got to do well. But the first thing is making sure you're following up with an obstetrician. So that's something that you, as a friend, as a partner, as my best girlfriend, like, girl, are you following up with your OB? Did you see somebody? Let me, I know someone. Let's get you in and get you connected, because then they can start talking to the mom directly about, are you smoking? Maybe you shouldn't be doing that. It's bad for your health, and it's very bad for your baby's health. Number one cause of low birth weight babies. Do you live in an area where you have access to healthcare? Do you need a ride? Do you need a bus pass? Do you need an Uber? How can I get you over there? All of those, it sounds like little things, but those are the first things that can at least even identify, could you have a problem? Did you have a problem in your previous pregnancy? And if that's the case, you should be following up even sooner. A lot of people even have an issue of, I'm trying to get pregnant, and there might be some factor involved in that. And so you need to follow up with the appropriate healthcare people to, if you're even in that factor, what could be causing an issue from that? So sitting down and talking with a healthcare professional that you trust, that you have a good relationship with, that's one of the first things I would say to any expectant mom. Now, if we're talking about warning signs and things, if all of a sudden, if that mom's not gaining appropriate weight during the pregnancy, there could be a problem. If you're having unexpected cramping and pain and bleeding, you want to make sure you're following up as soon as possible. That's one of the things that we worry about the most. If that pregnancy isn't going well and all of a sudden mom's having a rush of blood, or mom's feeling her blood pressure drop, she's passing out all the time, you need to get in and seen quickly by a physician. But there's some folks, I'm fine, I just didn't have breakfast today. No. You're pregnant, you got something else going on. You need to make sure that you're getting your health taken care of for all of those reasons.
Now, I know that people talk a lot, not a lot, but it's true that Serena Williams realized that the international champion of tennis realized she was having some kind of a problem. Do you know what it was? I mean, and they said she informed her doctor that and that's just a topic that's always comes up many times in conversations.
Now, I don't know the expected details on her issues because I was not her provider.
True.
but a lot of the issues that go on were during part of the problems was during the pregnancy. Was she suddenly having a decrease in her heart rate? Was she suddenly having these signs that she was feeling that there's problems going on? One of the biggest things that we get concerned about is, and this is something in medicine in general, are people listening to the mom when she's saying she has a problem? And unfortunately in medicine, one thing that we're actively trying to teach when we're teaching the upcoming generation of physicians, medical students, and residents is you have to listen to the patient. You have to listen very much to that person. If they feel that there's something strange going on, you've got to listen to them. And a lot of times people from underserved or marginalized communities are dismissed. Their symptoms are dismissed, saying, oh, no, it's not that. Oh, you're just having some stress. Oh, it's just some anxiety. And that's not the case. They're telling you something is wrong. They know their body. One of the things I stand by all the time is, you know your body. We know the medicine. Our job is to listen to you and try to figure out what your body is trying to tell us. And we have to pay attention to that. So a lot of times, if I remember correctly, I think one of her issues was that she might have had a blood clot that wasn't really picked up sooner. And I could be wrong on that, so don't necessarily quote me on that. But when they're looking into things where she's feeling like, I'm having some pain somewhere, I'm having some trouble breathing, people want to make sure that you're looking for all the possible sources that could be, especially if it's a mom that's pregnant. We can have situations where some of the amniotic fluid can move from where the baby is, get into the mom's bloodstream, and start going through and causing some problems. And you want to make sure that that's not happening. That's not causing mom's problems. But a lot of times, regardless of how famous you are, they may dismiss you just because, oh, it's okay, it's a person from this background, and you're not presenting your symptoms the way I learned it in medical school. And that's why we want to have enough people from multiple backgrounds to be able to have experience talking and listening to any patient that walks through your door.
Well, and that's something you just mentioned, talking about the amniotic fluid. I've never had children, so I don't know what it feels like, that sensation. But is that amniotic fluid, is that something that a mother could feel in her system, or is that something only a medical provider with tools would, and techniques and education, knowledge, be able to detect? How would someone know if something like that is happening?
Well,
What should
also,
they do?
well, as a man, I've never had children either, so I don't know what that feels like.
It's true. True
But
that.
from what we've studied in medicine, what we do understand about these, the amniotic fluid is, when the baby's inside the mom, when they're inside the uterus, when they're inside that little sac, that's the fluid that the baby's sitting around and floating in. And one thing that and there should be a certain amount that's in there, which is why we have this wonderful technology called ultrasounds. We love ultrasounds. No radiation, you get a lot of information out from it. And based upon, tons, again, going back to the data, there should be a certain amount of amniotic fluid that indicates that you've got a healthy baby living in a healthy environment. So as they check periodically during the course of the pregnancy with these ultrasounds, you can see, is there a certain amount of fluid there? Is there enough fluid there? Is there too much fluid there? Is there not enough? And all of those can indicate there's something possibly going on with the pregnancy. If you're early in the pregnancy, that first trimester, the second trimester, and all of a sudden you feel like, hey, there's a whole lot of fluid coming out from down below that should not be there. Does that mean that the sac is ruptured early? Am I in danger of having a premature baby? Because all of a sudden that environment that baby's in can affect their lung development. It could be related to the fact that the child could have a kidney problem and there's not enough amniotic fluid being even produced going on in there. So that amount of fluid going in and out, and if mom is feeling it come out, you need to be going and see somebody right now to figure out what we need to do to correct this issue. So, but also, as a mom, am I feeling the movement? Are we getting the appropriate movement going on there? Because that baby's moving around once you reach a certain size. But that's one of those things that people don't realize. You're not even getting that till you're somewhere maybe at the end of the first, beginning of the third trimester. It's not all of a sudden, boom, baby right away, first moment. That baby grows and develops. But keeping track of that fluid is one reason why we always say all these different parameters. How much weight is mom gaining? Is it an appropriate amount? Is it too much? Is it too little? Is this mom's first baby or is it mom's eighth baby? And somewhere in there, is the environment ready for there to be another baby in there? How was the previous pregnancy? Did it go well and were there complications? And if there were some complications, that could cause problems for the next baby that comes along and that mom decides to have another one.
Wow, that is so much to take in. How about okay, I know I'd ask, is your practice, like if someone is listening to this radio program and they're expecting, what should they do? You're a pediatrician. What should they do if they don't have an OB doctor? What should they do?
Okay, so this is where the internet is your friend. You can always look one up. So if you already have a kid and you're following up in my practice and you're like, hey, we're pregnant again. I'm like, oh, good. Did you talk to your OB? Because if you already have a baby, then you may have a relationship with a previous obstetrician. If you don't, and you happen to run into me, well, our clinics are affiliated with Oshai Children's Hospital and Kaleida Health. And Oshai Children's Hospital and Kaleida Health also are connected with obstetricians and gynecologists. The two clinics I practice in are over on Niagara Street and over on Broadway. Right next to the Broadway Market, 1021 Broadway, 1050 Niagara Street. But also up a little further on Niagara Street, we've got an OB clinic affiliated with Oshai Children's and Kaleida Health. There's, I think there's another one over on Kensington. Plus there's several independent OBs within the city of Buffalo. So
yes.
The first thing I would say is, Google OB-GYN Buffalo, New York, and you'll get a list of someone that is close to you. The other thing, and I think this is a great thing, talk to people that have already had children. Everybody knows at least one person that is my baby, and ask them, hey, did you have a good experience with your OB? Because that's really what it is. If you and your OB are vibing, if you felt that they listened to you and they took good care of you during the course of the pregnancy and then afterwards, because one thing that that's an important thing I remind every parent that comes in with that newborn when they come into my visit, and you should have an appointment with your OB at around the 6-week mark. Do you have that set up? Do you have that taken care of? One thing that people forget about when we talk about infant and maternal mortality, the other concept we all talk about as well is something called morbidity. Morbidity just means how sick you can be related to an issue. Mortality, unfortunately, means someone has passed. And one of the things that we pay attention to is, are there any post-delivery complications with the mom or with the baby? If that baby's underweight, if there's a birth defect, there's a higher likelihood there's going to be some complications after the baby's out. That's where I come into play as a pediatrician. But that mom also can have complications. And it's not just, oh my goodness, there was bleeding or something like that. After that baby's out, my hormones are coming back into quote unquote normal range. So you could have that postpartum depression where the baby's out, but you don't feel attached to the baby anymore. All of a sudden my mood is going up and then down and then up and then down. And recognizing that I've got something going on from that mental health standpoint, that's where you need to make sure that you're talking to somebody so that you can get yourself back into the right headspace so you can be there for that baby. Moms can have, they can have bleeding and blood clots that occur after the delivery that for whatever reason happen afterwards. You got to make sure you're connected and hooked up with appropriate care to identify that that's going on. But that I cannot underestimate and underemphasize that follow-up that mom should have at least at that 6-week mark with their OB, especially for not just to make sure that I'm making enough breast milk to feed the baby if I'm choosing to breastfeed, but also I've got that mental health component in there. If anything good came out of COVID, it's the fact that we really are putting much more of an emphasis on the mental health of everybody, but on moms in particular, because that's one thing that we used to dismiss. Oh, it's just the baby blues. Oh, you'll get over it. Your baby's here. You'll be fine. You'll bond. You'll be wonderful. And there's a lot more going on than that. You're not only expected to have the baby, but now be like the perfect nursing mother who's breastfeeding while in this perfect Zen mode. And you got to make sure that you're in a good spot and that the people surrounding you are creating that environment for you to feel that you're in the best spot to take care of both you and your baby.
And that was a question I was going to, or a point I was going to raise, was that, again, if the mom is depression or she just has a lot going on, you as that individual around her, part of her circle, please speak up. Please take her. Sometimes you just may have to say, honey, daughter, granddaughter, I'm sorry, but you have got to get to the doctors right now because there's something going on. There's something going on. If someone has to get to the doctors and they're new in Buffalo, and they want to go to your practice, what's the best way to contact your office for an appointment, for an emergency appointment? What should someone do to contact your office?
Well, again, as a pediatrician, once the baby's out, that's where I start coming into play. So the easiest thing to do is just, contact the clinic. The Niagara Clinic number is 768-7600. The Broadway Clinic is 852-1578.
I'm gonna have you say it just a little slower, both numbers.
Sorry, I'm just so used to and this is just the number.
Right.
But the Niagara Pediatric Clinic number is 768-7600. And the Broadway number, and I'm going to double check that, it should be 852-1578.
Okay. Now you talked about smoking as being a risk factor for both the mom and the unborn baby. Are there any other things that that moms need to be made aware of? I mean, there are so many articles, there's so many things out there. I'm not even going to mention any of them in case somebody doesn't hear the whole sentence. Are there any other things that when you are expecting a child, you're pregnant, are there any, besides smoking, are there any other risk factors that to avoid maternal and infant mortality? Is there any other risk factors we should be made aware of?
Do we have enough time on the program? I do not believe so.
We can always have a part 2. Don't worry. I've already thought about this. Is like part 1. Don't worry.
I joke about it. One of the best things to do is if we get like an OB that talks about everything going up, and then I come in as a pediatrician to deal with the baby afterwards, you've got like the whole picture right in there. We want to make sure we're hitting the entire spectrum of healthcare. I always mention smoking because it's the number one controllable risk factor for almost all these disorders you're thinking of. The best thing, don't smoke. Don't even start. If you already are, you need to stop during the pregnancy. Because for a variety of reasons, it smells bad. Let's just go there. But it can cause a lot of constriction to the blood vessels, which affects the amount of blood getting to the developing baby, which is how they are nourished and developed. And so this is one of the number one causes of having just a low birth weight baby. When we talk about multiple other substances, I know that there's tons of other things out there. Opioids, there's marijuana, tons of other products that people are using
and vaping.
Oh yeah,
Vaping would be considered.
well, and that's the hard part because a lot of times what they're vaping is nicotine, which is one of the active ingredients in cigarette smoke. But people can vape other substances. None of them are good for you or the baby. Okay. When we talk about just from what the CDC even puts out there, nutrition. People think that just eating is okay. Proper nutrition, we're rediscovering that food is medicine on a certain level. What you put into the body, what builds the body, is what's going to help contribute to you having a healthy body and lifestyle. So this isn't to say that you can't have that cheeseburger every now and then, but if you do that every day, it's going to cause you grief and problems. You're increasing your cholesterol, you're increasing your lipids and all those things, which are not the appropriate building blocks, because when you're pregnant, all of your resources go towards the baby.
Yeah, but it would be a cheeseburger with fries and a sweet tea.
Yeah. Which you can treat yourself to every, as Cookie Monster now says, there's all the time foods like broccoli and sometimes foods like cookies.
Okay, I like that. All the time and sometimes.
But it's about having a balanced diet. One thing they used to talk about was, oh, mom shouldn't exercise. No, you should exercise. That keeps your body healthy, keeps all your muscles and bones moving and active. And if you exercise before, unless there is a reason you should not be exercising according to your doctor, my blood pressure is having a problem, I'm really having an issue where potentially I could go into preterm labor because of additional stresses, then no, do your routine activities when you're a mom. They have mom yoga, they have mom Pilates classes. Do those things because that's going to keep you healthy physically, mentally, emotionally, all of those things, and provide a better environment for the baby. But one of the biggest risk factors they always talk about is access to care. And that's something that affects folks in both an urban community and a rural community. Do you have access to good medical care? Sometimes it's an issue of insurance, so you don't even realize that you can sign up for Medicare and Medicaid in New York State so that you have insurance to pay for these visits so that you can be monitored and make sure you have a good baby. And people forget that. These are things that affect people across the spectrum, regardless of where you live. Sometimes your zip code does determine how your health is going to be, but sometimes that zip code, whether it's an urban zip code or a super rural zip code, you're having the same problems. And access to healthcare is one of the biggest barriers we deal with nowadays. Just getting people to the doctor, being able to see a doctor, having access to a doctor. If you don't, you're sometimes, again, your body, but do you know the medicine to help you fix the problems or prevent you from having problems? But again, I'm going to go back to that first one. Stop smoking.
Stop smoking, stop vaping.
Yeah. And then because those are things that definitely affect both the mom and the infant. But when the baby's out, one of the things that we worry about on that infant mortality scale, sudden infant death syndrome, we're still trying to identify, what is the specific cause of it? We, from a scientific standpoint, we can't say it's definitively X. But we know that smoking is a huge contributing factor. And there's an increased risk in sudden infant death syndrome in families and households where there is smoking compared to where there is not. Co-sleeping. I know everybody wants to sleep with their baby in the bed, but that's a small, tiny mammal. And if you're one of those folks that moves and rolls during the night, you do not want to roll on your child. That will cause problems for everybody. And so we always recommend that baby should be alone in the bed, in their crib, by themselves. Okay, alone and the baby in the crib. That's all you need. All the stuffed animals they can get later. And if you're worried about the baby being cold, that's why they have those little halo sleeper sacks. You got the baby in the onesie, you put them in their sleeper sack. They are warm, they can still kick their feet, and you can put that bassinet right next to your bed so you can have your arm right there to the baby. But don't have them in the bed with you, not a newborn. That's just nope. And
that was my question, to talk about a bassinet. I know we are running out of time. What if your grandmother or your mother or your sister or your aunt had a high risk, what was at risk of during pregnancy, had an underweight baby, had a premature baby? How great is that bloodline in terms of how, if you're the daughter, how risky is it? Is it hereditary? I guess that's what the word I'm trying to use.
And again, that depends on a lot of different factors. It could, for some individuals, the size and shape of the uterus could be quote unquote abnormal. I'm not trying to say that's something wrong with you, but if the size and shape are in an alignment where the baby's going to be growing in a different posture, because everyone in the family has got small hips, or everyone in the family has an inverted or retroverted uterus, that could be something that could predict for just the environment being a little bit little bit touchy for that baby to go through. So it's not that it's a direct one-to-one correlation. Oh, my grandma had a lot of problems. I had a lot of problems. But that's something you want to tell your OB up front so that they can prepare ahead of time to make sure and monitor you appropriately to make sure that doesn't come across. Now, the one thing that we pay a lot more attention to with that is that if there are any inheritable genetic diseases or genetic defects, if we know that they run in a family, that's something that we want to be making sure we're monitoring and testing for early, just to make sure that things go well for the baby. So it's not necessarily, like I said, there's not like a direct one-to-one, but we're going to pay much more attention to the mom that says, well, you know, my grandma had to have a C-section for all her kids. My mom had to have a C-section for all her kids. I'm worried I might need to have a C-section for all my kids. And what were the causes behind that? Was it because of elevated blood pressure, which tends to run in my family? And, you know, rather than run the risk of pushing and causing that issue, let's just get that baby out and do the C-section, because now the baby's out and that blood pressure is going to come down right away. So we want to make sure that we know the history of the family. That used to, and that's something that's really good about modern medicine. Back in the day, people didn't talk about medical things. No, that's improper. It's private.
Right.
Don't discuss these things amongst families. And now you have to, because so much stuff does run through families. Doesn't automatically mean it's going to affect you, but we should know just so we can take that into account.
And Dr. Archer, on that note, I'll send you an email when we should have part 2.
Fair enough.
And I know that the reason we're having this conversation, because you're going to be part of a program or speaking somewhere, and that's when I gave you a call/email. So I want to thank you, because we are like out of time, and I can't believe we're out of time. But I want to thank you again, Dr. Archer, for being our guest this morning on the Great Lakes Health Radio program.
Always a pleasure.
Thank you. And our topic has been maternal and infant mortality. I also want to thank Kelly Carmone, who was our first guest today. Next week, you will hear from my esteemed colleague, Cindy Bass, who I saw last week in an event. Always great running into Cindy. And my name is Francesca Messiah, your host from Kaleida Health, Manager Workforce Development. And remember, if you're looking for a job, a career, a new career, please visit our Kaleida Health website. And until then, in 2 weeks, I'll be back. Be good. And we're at that time of the year. Go Bills. All right. Thank you, listeners. Bye-bye.